child has the right to grow up healthy and strong. Thanks to the generous contribution of the government of Japan, this is becoming a reality for many children in Ghana. Through our close cooperation with the Ministry of Health and the Ghana Health Service, we have seen significant results over the past years.
The people and government of Japan are very happy to be able to support a very important project in Ghana in the area of health and nutrition. Currently, we are engaged in collaboration with UNICEF, 3 projects. 2 of them are in the area of fight against COVID-19, and the third one is for the use of maternal child health record book. So these 3 projects put together, the total budget size is about $3.3 billion. And the people of Japan and government of Japan are very happy to be able to contribute.
The Japanese government has supported us in many ways that have helped us improve outcomes. And there are very critical interventions that we have received from the Japanese government, particularly through JICA over the years. Some include maternal and child health services, nutrition services, improve the child care. We've also had a lot of support in terms of the maternal and child health records, which has significantly improved the way we run our maternal and child health services and also improve significantly outcomes.
Over 160,000 more mothers can track their children's growth and development through the Maternal and Child Health Record Book.
We have the programs, including in the Eastern region, and which we are very proud.
For example, health workers have received training on maternal, child health and quality care. Life-saving information on child health is now widely available for all partners through innovative knowledge-sharing platforms. 120,000 children are benefiting from micronutrient powders to reduce anemia.
The Japanese government has really supported the Eastern region. Among the many support that we received funding to train a lot of health workers in all the 33 districts in the region on the reproductive maternal and newborn child record, the guidelines, and also on the maternal health child record book. And not just the training, but we also received funding to do supportive supervision of the staff who were trained to ensure that they are doing the things that they were trained to do.
The government of Japan has also been a key supporter in overcoming the COVID-19 crisis in Ghana. A new COVID-19 testing and diagnostic machine with 2,000 test kits is now used by the Eastern Regional Hospital. This is a significant resource for speedy testing and COVID-19 diagnosis.
In fact, when we started managing the COVID-19 outbreak, it could take as long as 2 weeks and over to get lab results. And definitely that's not quality when you are talking of healthcare delivery. And I must say the PCR machine came at the right time, because before we had a capacity to test our COVID-19 samples, the region had to transport all its samples to either, Noguchi or other, the VSD, Veterinary Service Department laboratory, and other labs like KCCR to get them tested.
Since we received the PCR machine, we've been able to test about 836 cases. And since then, we have been able to reduce the turnaround time from 72 hours to 4 hours. That means whenever we suspect somebody having a COVID, the person will be kept at the holding area for only 4 hours. Thereafter, when it's confirmed positive, the person is sent to the treatment center. Negative, then the person is sent to the ward. So it has actually brought improvement to our service delivery. And also, it has also even encouraged more people to really come to take the COVID test, because they know that when they come the same day, they're going to have their results on that same day. So we would like to appreciate the government of Japan and UNICEF for donating the PCR machine.
Over 50 schools and 10 healthcare facilities have been adequately equipped with water and sanitation facilities.
We also received support from the Japanese government to train staff on infection prevention and control. And I must say that almost all staff of the Regional Health Directorate, Eastern Regional Health Directorate, received some level of training in terms of IPC, and which came very handy in the midst of the COVID-19 outbreak.
And even during the pandemic, thanks to the government of Japan, over 500,000 children and women have received essential services, and these include immunization against preventable diseases, pre- and postnatal care, and essential care for survivors of gender-based violence. UNICEF and our partners also reach more than 120,000 people with life-saving messages on COVID-19 safety, prevention protocols, and good hygiene practices.
Today we are here at Jumapo, which is one of the sub-districts in New Duaben North. And we want to use drama to educate and inform the community about the risks and some myths and misinformation on the coronavirus. So in general, we have also used the grant to get influencers in the traditional group and then the religious leaders group to also do an advocacy message and talk to their people on it. Apart from that, we have also been able to have adolescent groups who are also form peer education groups on radio, community radio, and are also educating their peers on the myths and dangers of COVID-19 so that we can all stay safe.
Looking forward, we are so pleased that 30 health centers will soon be fully equipped with ultra-cold chain equipment. This is essential to store some of the COVID-19 vaccines at low temperatures and will continue supporting the COVID-19 vaccination campaign.
We call it cold chain. You need freezers and cold storage, not only in points of locations, but also during the transportation. So government of Japan has decided to work with UNICEF to deliver such facilities so that vaccines can be delivered and to be put to use for the sake of keeping people safe and happy.
The challenge we have had with vaccine and COVID is the fact that we do not have access to all the vaccines that we can have. The key among them is the ultra-cold vaccines, for which we do not have the necessary infrastructure to be able to manage them. The Japanese government support in procuring ultra-cold cold chain facility for us will mean that we'll be able to have access to other vaccines like the Pfizers and the rest to improve our ability to attract more vaccines and vaccinate our people across the country.
As I travel to different parts of the country, I see the smiling faces of people. That is the great reward we feel. And the people, for example, in the eastern region, they have been very forthcoming in working together with us, with the government of Japan, with UNICEF.
UNICEF is truly proud of this important partnership with the governments of Ghana and Japan. Together, we're making a real difference in the lives of children and families. Many thanks to the people of Japan.